All right, hello, good afternoon. My name is Jacob Les King, and I am currently the care manager for Alejandro Garcia Marquez. I'm going to include an SBAR report along with my recommendation of how to continue with his care, and what we've done over the last 10 weeks. Right? So, the situation Mr. Alejandro Garcia Marquez is a 72-year-old Hispanic male. He is Catholic. He lives at home with his wife. Um, who is also in good health. He was a construction worker and then a foreman for about 35 years after immigrating to the United States with his father, okay, in his early 20s. He is currently supported by his retirement income, Medicaid insurance. He has two daughters that live close by, frequently communicate about his care and about different things going on in their life. He's never smoked, very rarely drinks, mostly on special occasions. He's active. He enjoys a evening walk, and he tries to keep himself in good health through good diet and nutrition. And that's part of what we've been working on. Um, Background: patient is suffering from COPD, okay, specifically chronic bronchitis and emphysema due to inhalation of irritants for many years while he was working construction without proper masks and things like that. Other medical history includes osteoarthritis in the knees, and he does have liver disease that we've been working on treating and managing the best that we can so far. Um, so, his current medications. His medication list consists of lisinopril to combat the issues with congestive heart failure. He is also taking some acetaminophen Tylenol to help manage pain from a fatty alcoholic liver disease. Um, his primary diagnosis, the COPD. He is currently taking Norco hydrocodone, also for the pain associated with the liver disease, and then different issues that he has with coughing and the osteoarthritis. He takes that twice a day with meals. He does take terbutaline, an inhaler, up to 4 times a day to help relax those smooth muscles. He mostly uses that as needed. And we're trying to get that number down just a little bit because we don't want to get into too many of those medical complications with that. He's also taking salmeterol, long-acting smooth muscle relaxer 2x per day. We normally try to do that one in the morning when he gets up. He goes on a morning walk at about 9, and we also try to do that before he lays down at night. Um, and then he's also on carbocysteine, which is a mucolytic. Um, he's taking that to help break some of those secretions up in there. He doesn't normally like that one, but I've been trying to encourage him to take it a little bit more often because he has had a little bit more trouble during his percussion therapy these past couple of weeks. So we'll have to watch that. Um, so over the past 10 weeks, we've gotten to know what he desires from a healthcare standpoint, and I've got a lot of information in his chart that I'll share with you, and then you can read notes and get a little bit more information on that. But basically, some of the things that we've done are make a couple of medication modifications based on what works better for him. We have had a little time to play around with that. Um, I've talked to him about different activities that he needs to partake in, modifying his diet and his lifestyle to help kind of give himself a better outlook with his disease processes that he has going on. So we've talked a lot about that. We have made some good diet modifications. We've had a lot of good education sessions as well. I made sure that he's continuing his normal level of activity. It is hard sometimes if he's having an exacerbation with a COPD, but he has been for the most part able to keep up with a lot of what he was doing beforehand, before the diagnosis, because he is taking his medication. He's fairly compliant with everything um, on his medication list. And then very recently, Mr. Marquez and I have discussed an end of life care plan and how he wants that to go. So basically, he wants to stay at home as long as he can. He wants to be cared for, ideally by his family, which is in line with some of his cultural values and beliefs. And then ideally, he would like to pass away in home. So he recognizes the need for like a palliative care hospice for his family whenever it does get a lot closer to his passing. And he has agreed to that. He has agreed to have them come into the home and care for him just to try to reduce some of that emotional burden on his family once it gets to that point. And we are going to give Mr. Marquez the information needed to talk to someone to create an advance directive. Um, he's going to want an A&D to allow natural death, and we've discussed that. You can follow up with him on that and make sure that that is still his decision. But he was pretty adamant that he did not want to continue with much supportive methods to prolong his life after a natural death. So um, you can follow up on that, and we can see where that goes. And then finally, we've been engaging in some education sessions with the family about the percussion therapy, about the medications, about different things that Mr. Marquez is going to need moving forward. Um, I have all of my information to contact me, and then my recommendation to continue his care would be to move forward with the end of life care plan. Make sure that Mr. Marquez feels adequately supported through that. Um, like I said, we're going to keep looking at that carbocysteine. We might need to change it a little bit, given he may have be experiencing a little bit too many side effects with that. So we'll follow up on that. Um, but we'll just keep evaluating his psychosocial status and his interaction with his family, and then track his progress as his disease does progress. Right. I think right now he's in a pretty good place. Um, they did mention, the family mentioned that they would like to have a senora come in, which in the Hispanic culture is a woman who has like special healing properties, and maybe use some natural remedies to help alleviate some of his symptoms. And I just told him that we would just need to communicate and make sure that none of those remedies interact with any of our medications, and then that would be perfectly fine. Okay, so that's also something we'll need to follow up on. Um, if you have any questions, contact me and we can discuss this further. Okay? So thank you very much.